Okay, so this video is an introduction of why health economics for this class. Um, I'm gonna go through some backgrounds about this class, and it will mostly focus on the United States healthcare market. Okay. Okay, so why is health economics interesting? In the United States case, the healthcare economic is massive and expensive, and we all know that it is much more expensive in the United States than in a lot of other countries if you come from other countries. Okay. Another thing is that it is expensive, but people have to use healthcare, okay, because health is a major source of uncertainty and risk. And government around the world are deeply involved in financing the health system. This is because people don't plan for their healthcare expenditures because it's uncertain. And so government has a responsibility to help deal with that. And it's very complicated. And so that is why health economics becomes very interesting. In terms of a scale, this is a graph of healthcare spending for United States from 1962 to 2022. And for 2022 is predicted measurement, okay? And so we can see that the amount of money is increasing very fast, okay? The next one is healthcare spending as a share of GDP. We can think of that as not only healthcare spending is increasing, we know that people's income is increasing as well, but people are actually spending more money from their income or a higher fraction of their income into healthcare. So this 2022 projected value is almost 20%. And so that means every $5 that we earn in this country, $1 of it is spent on healthcare. Okay, so that is a very big number. And I want you guys to put this number in your mind because it's a good way to convince people why we want to care about this. We have all of these big industries, but none of them is as impactful as health industry, right? Health spending per capita. This is from 2002 to 2014. It simply says that there is a huge fraction of money that people spend on health spending. So think of 2014. I think it would be nice to have a number for today, but in 2014, if everyone has to spend $9,000 a year on healthcare spending, that sounds crazy, right? It sounds crazy for us as healthy young people, but it's not as crazy if it's for people at the end of their life or at the later stage of their life. This one is health insurance spending per enrollee. So people are grouped into different groups as their primary insurance. So the first group is Medicare. We can see that Medicare patients spend highest amount of money every year. And the reason of that is people get Medicare when they turn 65. I think Medicare also insures some disabled people who are less than 65. So we can think of these people as an older population or less healthy population of the society, which makes sense that they spend more. For Medicaid, so Medicaid is primarily for low-income people, and Medicaid also insured pregnant women, if I remember correctly. we can think of that as not as expensive or not as much as Medicare, but still more than employer-based insurance. Okay. And this is because employer-based insurance insured a bunch of people in the population that is the most healthy. Okay. The US healthcare economy is massive and expensive. We put a bunch of numbers out there, and this trend has been similar in countries around the world, but no country spent quite as much on healthcare as the United States. So where do we get for all of this money? This is health expenditure as percentage of GDP, and GDP as billions of dollars. Okay, we can see that health expenditure as GDP fluctuates, but simply just keep on increasing. The other thing is health is uncertain and contagious. Okay, we know much more about contagious after the pandemic, but how about uncertain? So people usually cannot predict how many surgeries they're gonna get, because you might think you'll never get a heart surgery, but maybe one day it just happened. Okay, but you can more or less predict how many TV or bananas you need every day, right? Or every year. Okay, so that is uncertain. It's like less easy to predict. Okay, and contagiousness is that if you have a banana or TV, it doesn't affect people from having banana or TV. Okay, or maybe because you are popular superstar, so you have a TV and people also want to buy a TV. But it's not as much as health, because if you get an infectious disease and you roam around the city, it's gonna affect people. Okay, so that's how we call contagiousness. Okay, so once something is contagious, and we call that externality. Okay, that creates externality, that the cost of you getting an infectious disease is not completely bear on you, because you might feel sick and you own the sick days, but the fact that you might make other people sick is not going to build on your medical bill, right? Think of if you get sick, you buy some medicines, that's from your money. But if you make your friend sick, you're not gonna pay your friend's medical bill, right? So that is externality. Externality means that the cost and benefits is not bear on you completely. Okay, so once there is externality, government has, we believe that there needs to be someone, usually the government, to come intervene and help contain it. Okay. Probably speak a little bit more about externality. So think of pollution. If you polluted, if you are a factory and you polluted some areas, water or air, it is gonna cause a lot of people's health, but did you pay for those people's medical bill? Maybe not. And that is why we need the government to put out pollution control guidelines, right? If that's a way to internalize externality. So it's kind of like, if you need to pollute, then you have to pay these kind of fees. And using these fees, we can move people away from your factory. We can pay for their medical bills or whatnot. So once there is externality, then there is room for economists to come in and analyze the problem. Another thing is the health economics is a part of public finance. And why is that? Public finance speaks about how government should collect taxes and how government should spend taxes, right? And in a lot of countries, governments play a huge role in health markets because the features just discussed. In countries like UK, Sweden, Canada, the government is responsible for a vast majority of the healthcare expenditure. You might think, oh, US government doesn't pay for people's healthcare. That is not true. Even though with its private healthcare system, the government is responsible for half of all healthcare spending. So in the United States, half of the healthcare spending is actually from taxpayer money, and it's actually managed by the government. Okay. And which are those programs? I've already mentioned it. It's Medicare and Medicaid. Okay. This is different countries in terms of how much they spend on healthcare. We see that US disproportionately spend much more. And this is a number in 2011. In the United States, the public spending is higher than any other countries. But we can argue that United States is bigger country, right? As a share of GDP, yeah. And then the next one is hold on. So US spend a larger share of GDP than these countries in terms of public spending already. And on top of that, out of pocket and out of private almost spent another huge share. Okay. That sounds crazy. Okay, next. Healthcare is only getting bigger and more expensive for the government and taxpayer. So this is important if you're considering a career in health, because this industry is only going to grow. Okay. And another thing is because of increasing life expectancy, people are getting older, they are living longer, and the graying population throughout the developed country will place stress on public health insurance systems. And governments have to cope with it, have to come up with solutions on how to or whether to pay for the expensive new medical technologies. So given these trends, we can confidently expect healthcare to be an ever-growing line item on government balance sheets. So this graph is medical expenses for elderly. We can see that from 2001 to 2011, there is a higher and higher share of the blue square, which is for Medicare. Versus there is a smaller and smaller share of other and out-of-pocket payment. Okay, so then there are some questions that economic reasoning can answer, and we call those positive questions. The other side is normative questions. So does everyone deserve access to healthcare even if they cannot pay? Should people be compelled to purchase insurance? When is it ethical to deny care to a dying patient if they cannot afford? Or should the government ban certain unhealthy foods because it's making people obese or making people subject to cancer? These are more of like a normative questions that I would say it's more of what the societal consensus is. In the United States, people vote for candidates that believe in things that they believe. And so how the government will do depends on what people's consensus is. Economists instead can answer positive questions. So for example, how much does it cost to provide free checkups and drugs for everyone in the population? So this is something that can be calculated. Okay. The next one is, do strict patent protection for new drugs spur innovation? How much would consumers save if doctors were not required to have medical degrees or licenses? And would a tax on saturated fat make a nation healthier? So these kind of questions can be answered by economists because we can use data, we can use randomized experiments to answer it, or simply by calculation. So in this class, we'll mostly focus on the positive questions, right? Because those are the things that we can easily tackle, okay? Instead of normative questions that there is not a single correct answer. I would say it's very interesting because the unique US healthcare market, patients sometimes pay out of market for routine healthcare like flu shots and health checkups, versus in many other countries, patients almost never pay for it. I believe I get free flu shots from CVS. So I may be in some other areas of the United States, or in the past, it's not free. In the US, some people are not eligible for government insurance and cannot afford to buy private insurance. I think this is a huge question. It has been debated politically for so many years, but it's never even a debate in a lot of other countries. Okay, in almost all the other developed countries, uninsurance is extremely rare or even non-existent. Insurance is either provided for free by the government or provided by a mix of public and private insurers. Okay, so then even though the US market is unique in its way, how much of our empirical evidence will come from our empirical evidence will come from the US, because we live here, and the focus of this class is to understand this market. But there are some things that occurs in private markets in general, like adverse selection, moral hazard, and monopolistic firms. So understanding these problems is critical to understand why other countries approach health policy is radically different ways. Okay, so that's it for the first chapters. Starting from the second chapter, we go into details about many of the questions we have just discussed.